So we have a 2-minute 55-second small video use of 3D printing in health solutions. So less than 3 minutes. So lights to be dimmed and volume to be put up.
The mind of man can conceive. He was talking about cartoons, but advances in technology have taken that basic concept to a whole new dimension. Michelle Miller shows us how the idea of a modern-day inventor became a 3D reality.
Grabbing a backpack is hardly the feat of a superhero, unless you're 12-year-old Leon McCarthy and your hand looks like it's straight out of a science fiction movie.
You've actually become sort of a
cyborg.
There's a cool factor.
Yeah, it's like a special. It's special instead of different.
Leon has been special since birth. While he was still in the womb, restricted blood flow prevented his hand from developing.
I saw his hand sticking up and there were no fingers on it. It was hard for my wife, it was hard for me.
2 years ago, his father, Paul, began the search for an inexpensive, functional prosthetic. What he found was this internet video posted by Ivan Owen, an inventor in Washington State.
I've always had this vision of people being able to build their own prosthetic device at home.
Owen and a collaborator in South Africa designed a hand that could be made by a 3-dimensional printer.
It's essentially like a hot glue gun. It's plastic that feeds into it. The printer head gets really hot, it liquefies that plastic, and then layer by layer creates an object.
The design relies on wrist movement. Downward motion creates cable tension that closes the fingers, while a move upward opens them. The assembly instructions were posted for free on the internet, so someone like Paul McCarthy in Marblehead, Massachusetts, could print it. He took the idea to his son.
I thought it was a little crazy. He was like, we can print all these fingers and then like clip them all in, and it was a little too much.
The first time you saw it and when you tried it out,
it was pretty awesome, yeah.
What made it awesome?
I could pick up, say, like a water bottle. Like, say, I could pick up my pencil.
What is it like to see him with this?
Making your kids happy is like the most rewarding thing you can have as a dad, right?
The price tag was also appealing. Many 3D printers sell for about $2,000. Materials are far less expensive.
This thing cost us like $5, $10, you know, whatever. It was nothing.
What would a prosthesis cost you?
$20,000, $30,000.
The cost allows father and son to experiment with newer designs.
When I outgrow a hand, we can easily make a new one.
It's a do-it-yourself solution that was unthinkable before technology made ideas printable.
That's cool.
Yeah.
Michelle Miller, CBS News, Marblehead, Massachusetts.
Another mind-blowing video, very interesting, and thank you very much, sir. Now we are heading towards another session of health, then we'll break up for tea. This session will be best practices in healthcare from eHealth to mHealth. For this session, I invite the session chair and other panelists on the stage. I'll start with Ma'am Sujata Sonik, Principal Secretary, Public Health Department, Government of Maharashtra. And we invite you on the stage. Then we have Mr. K.V. Varki, Managing Director, Hindustan Antibiotics Limited. Sir, we invite you on the stage. A round of applause for Mr. Varki. Then we have Mr. Zia Saqib, Executive Director, CDAC, Pune. CDAC is doing a lot of work in mobility solutions, and some of them are in health as well. And then I invite Shri Dr. Nomal Chandra Bora, Chairman and MD, JNRC Hospitals Limited. Dr. Bora is a long time, a good, very well-known personality in healthcare sector across India and abroad. Now I invite Shri Rajesh Kumar S., Senior Technical Consultant, Juniper Networks. Okay. Rajesh ji is not there. We have Mr. Sanjeev with us from Juniper. Now I hand over the session to Ma'am Sujata Sonik.
So, Mr. Ravi Gupta and also Bakshi sir, all my colleagues from within the state and also from all over India, and representatives of various institutions and organizations who are here today, you already have received the bad news that your tea has been postponed by yet another session. And you have to be patient and listen to all of us before we can break for tea. The good news, however, is that this is not going to be a very long session because you can see the size of the panel. It's not very big. And we'll try and finish our proceedings as is easily possible. So I welcome all the panelists with me here this afternoon who will be speaking on different issues regarding to healthcare and how we can move from e-governance to mobile governance. So if my panelists permit, I would like to start with the first presentation and then pass on to you. Maybe you would like to go? It's not a very big presentation. It's about 16 slides. Take about 10 minutes to go through it. I'm going to focus on what is M-governance, which is the next generation of public services, and talk about the global ICT developments also. And then what are the benefits and challenges, the value chain model, how one can go about it, the policy formulation and guiding principles, the adoption model by government, then what kind of government to citizen, government to business and government to enterprise services can be incorporated, the impact of such a model. Then I'll just highlight some of the key international governance projects like this, both in India and also abroad, and then come to the end about what is it that is possible in India. Now, what exactly is M-governance? It is the adoption of mobile technologies to support and enhance government performance and foster a more connected society. It is emerging as the next big wave of information and communication technology used in the public sector. It ensures, of course, that there will be innovation in service delivery. It will empower digitally deprived citizens. It will intensify partnerships and exchange between public and private sectors. And it will also enhance public sector performance and good governance. In the public health department, we at the moment are using something called the pull SMS that is generated from hospitals down to the PHCs, and also our mobile medical units, and also bulk SMS, in which we get daily information of the figures on number of IPD, OPD patients, the deliveries that have happened, the babies that have been born and their birth weight, and so on and so forth. This slide I wanted to show you because it's very graphically shows that the way the mobile penetration has changed in the world. Ever since we have moved from fixed telephone subscriptions to mobile cellular subscriptions, you can see that both in the developing and the developed world, there has been a huge penetration led by the mobile technology. There are, of course, many benefits, so are there many challenges. If you look at the, very typical conventional government model, it's available only for fixed number of hours. It's only for the working days, and so if there's a holiday or a public holiday or a weekend coming in, then you find that you are not able to access many of the services. Whereas if you look at e-governance, then it is available perhaps 24 hours, 7 days a week. You can use it from home as well. You can access it easily. But when you go more forward to the M-governance model, then there is a total seamless integration and linkage of wireless devices. It's available 24 hours, 365 days. And it is irrelevant where from you are accessing the information or the service. All you need is the access, and you shall be able to continuously seek those services. So the benefits are that it has a much wider reach. It is, of course, mobile. There's more personalization of services. It's more cost effective. There's faster information flow. It's better managed. There is more democracy in it. It also enables a green government. The challenges are there's a cost involved, and who is to pay for it? That becomes an issue. There could be an M-digital divide. You will find senior citizens often getting deprived and left out of this model. And then sometimes there is a mindset that people feel that this is more for entertainment rather than for actually doing any serious work, and so on and so forth. This I just wanted to show you because what it talks about is how can you actually implement it. There are, the regulatory framework has to be first made very clear. The funders have to come into play. Some amount of funding can come from the government, but you also need private partners to chip in. You have to, the government would obviously be the main mover, where it would aim for developing systems which can do better analysis. There's more integration, there's more interoperability, so that in case there's a database which has been created under one program, it can be accessed by other departments and duplication can be avoided. It's more reliable, security would be an issue, and so on. And what it would lead to ultimately is more engagement of the citizens, better customer services, improved economic development, and some of the sectors which can be affected by it are health, governance, payments, enterprise applications, mobile workers, and also improve public safety. It would impact, of course, citizens, business, and government all alike through, of course, the service provision. There has to be internet service, and there has to be mobile service, and there have to be platforms through which the access can be provided to access those services. Now, policy formulation would necessarily have to take into consideration the following key features for the next generation of services. It has to be a more citizen-centric approach. We will have to move towards a system or a model where service becomes the key word, the buzzword, and how can citizens access that service. It still remains a challenge despite many efforts having been made already, and it will definitely increase transparency and the citizens' ability to measure what kind of impact government programs are having in their area and how they can participate in the development. So M-governance is not really a substitute for e-governance. It does not replace. All it means is that there would be applications which can run on mobile devices, but not all applications can run on mobile devices, and therefore e-governance cannot be replaced totally by M-governance. It has to be conceived and developed as an overall part of the e-governance strategy of the government, and we have to balance the M-government applications. It should not be so trivial, and it should not either be too difficult for anybody to use. In deploying these applications, we have to ensure that citizens also get what they are seeking in the shortest possible time. If the system is so cumbersome that access becomes an issue, then it is not going to work. Now, the M-government adoption model by government could possibly look at these four sectors. What are the government to citizen services that can be provided? What could be the interaction of government with businesses and the different permissions, etc., that are required by businesses? It could also become a tool for conveying important messages between government and its employees, which I think is often not utilized to the extent it can be, and also from government to government. It could be interagency sharing of information and also database. So it could be both individual and organizational. Most, of course, the mobile applications which are likely to be very popular are the ones which will be government to citizen services, which will allow the citizen to not only seek information from the government, which often becomes an issue. We know the kind of revolution the right to information has created, for example, and it can request services, ask questions, it can complete transactions from the security of its own home or workplace, and it can also give very important and crucial feedback, report problems, and request emergency assistance and access data. So therefore, the M-government model, which would be very relevant for government to citizen services, could fall under informational and educational services, interactive services, transactional services, and government to citizen engagement. Here I would like to just pause and give you an example about how the PWD department in the state of Delhi made a switch over from recording of complaints for repairs which were done first in the traditional manner to a system where you just had to call 1-800 number and register. You had to inform them about your location, the type of problem you have, and register your complaint. And then it became so easy that within 24 to 48 hours it was being attended to. This eased the problems faced by people who were constantly pursuing the PWD during working hours and not finding those people on the desk. And the PWD further outsourced the repair work to a number of agencies who would look into plumbing, electrical problems, and so on and so forth. And so the whole thing started working in a much more organized manner, and it definitely also reduced to some extent the kind of inefficiency that one would normally encounter with the PWD. I have already mentioned this, but where I want to focus a little bit is on the interactive services, the health services, and also education and other sectors. I feel that if we can include certain packages at the time of giving a SIM card of a mobile phone to citizens, then there are so many things that citizens could get informed about without government having to then spending a lot of money on creating awareness about what they need to do. So simply in addition to people nowadays surf the net for weather information, they surf the net for additional information about a place they are visiting or traveling, etc., exchange rates, gold rate, and all those things. But it could also impact very well in these social sectors like health and education, and also security, where you could be reporting a crime that you've seen an accident and you would want to report it immediately. Everybody today has a phone in his hand or her hand, and it could really cause a social transformation in the way people report. I would skip this for the moment and come to this. What is going to make this development model successful is, first of all, the way the government policy is set. How do we impose conditions on service providers, and what kind of promotion we do through our various agencies. There could be possibly certain cultural factors which would inhibit. Some people may not easily take to it. It may have a period where there would be some amount of delay, and not everyone would be on the same page. But over and above, nothing succeeds like success. So once people realize the value of using mobile technology, and also that the costs are low, there are no social or other barriers. If once you start using the service, everyone is treated as equal, then it is definitely going to set the tone for further penetration. And the areas where I've already mentioned this, it could be very effective are health, education, commerce, e-commerce especially, entertainment, investment, civic participation, and safety and security. The impact of m-governance so far, therefore, has been that it provides government a new channel to transmit its policies and its services to people. It is something that would raise awareness amongst users, and it could become a very critical area of development in future. These are some of the key international m-governance projects. I took them out from the net. As you can see, we have already heard about weather and traffic related issues being sent out to people, but in certain countries it is being even used for reminding people to return their library books, and so on and so forth. Even in a country like Rwanda, they have a system that allows students to access their national examination results via their mobile phones. I don't know if it happens in India. I am not sure about that. In Bahrain also they have a very interesting service. Singapore, of course, Istanbul, Malta, Turkey. These have been some of key m-governance projects in India. The dark net Then the Lokwani, the voice of the people, an innovative model of citizen service centers. They can register and track their own petition in a nearby kiosk. And SMS-based services for challan status inquiry. I'm told that the customs department effectively uses this system. You can actually track your package which you have booked for overseas cargo. Health projects across India, very, very interesting. The first one, patient appointment scheduling of medical institutions. This is being done in Delhi quite successfully. And subsequently, the second one, battling counterfeit medicine with an SMS. I'm told this is a project that has been taken up by some pharma companies. Pharma Secure is a company which has actually led the setting up of this system. And then survey of hospitals to check compliance for IPHS is being done by Kerala. And this disease and epidemic outbreak tracking is being done by Gujarat and Kerala both. And again, this doctor SMS providing details of your nearest health facility is something that Kerala is doing. So call and get either a regular ambulance or blood on call 104, and 108 is for emergency medical service. So if these could already be preloaded on the SIM cards, then citizens could access them. I mean, you don't have to carry out a separate advertising campaign to inform people about the use of these numbers. You could also access patient records and lab test results. You know, you have something like this Lal Path Labs. You just go to the website and you can find out if your lab report is done and is already loaded. But it could be linked to mobile technology. The message could, I think they do send a message out on your mobile also once your report is done. But this could become like a normal thing, that even if you went to any other lab, you should be able to get a reply that your report is ready. It could also, this is something that we are looking at now in Maharashtra, because our blood donation is really dipping and we don't have sufficient blood stock at times. So if at the time of registering for a SIM card, if a person is also asked to indicate their blood group, then whenever there's an urgent need, a message could be sent to a couple of donors to report to the nearest place wherever blood is urgently required. SMS alerts on outbreaks and preventive measures are quite common. We don't do it, but I think this is something that we could do. There is an organization called the GDAX, and they run a system where you can either go to the website or you can register yourself and they'll give you an alert of any category 5 or 4 disaster anywhere in the world. So when the tsunami hit Japan, all those people who had already registered on the site got almost instantaneous message that there has been a huge earthquake in that region. Similarly, electronic billing for in-home healthcare workers could be done, especially ANMs and ASHA workers. There could be better awareness generation on health and safety education by giving messages, and so on and so forth. I think text for baby is an excellent concept that could at least advise pregnant mothers and new mothers that their vaccinations are due, because even these people have their mobiles. So this could become another penetration for the health department to look at, and so on and so forth. So thank you very much. Okay, so may I then invite Mr. Barua, CMD, GNRC Hospitals Limited, to please make the next presentation.
And before you, my thoughts and share my ideas with you. Though my subject is little out of place, it's E&M governance in healthcare. I would like to touch on few basic things which I think is not less important than E&M governance. What is healthcare? Healthcare is one human being taking care of another human being. My association with healthcare is of last 45 years as a doctor. I am a neurophysician. I work in the northeast part of India. That's a very underdeveloped area. I have been working for development of healthcare services in that part of the country. And during last almost for 27 years of my working life, I have developed 2 super specialty hospitals, which are state-of-the-art, the pioneering hospitals of that region. Financially success, also service-wise. But I am a very unhappy and disturbed man, having 2 hospitals, being established in one of the most difficult areas of the country. I'm not happy. I always feel I could not do things which I wanted to do. What is the cause of that unhappiness? If I look at the healthcare scenario all over the country, I find that during last 45 years, lot of private hospitals have come up. But 80% of the people of this country cannot go there because of the cost. On the other hand, the public hospital where I had worked earlier, including All India Institute of Medical Sciences, are unable to bear the burden of patients. That is 80% of the people who cannot access private healthcare because of the economic condition. As a result, there is lack of quality assurance in the public hospital because they are not able to manage the crowd. Where is the solution? Can we combine quality as well as affordability, both in the public as well as in the private sector? 3 presidents of America during last 2.5 decades have tried their level best to find a solution to the problem. Leave aside the other developing countries, including India. There was no shortcut, ready-made answer to the problem. Then what do? We decided to go back to the community and relook the problem in a different way, just to see if I can find an answer to this problem. We decided to go back to the community 2 years ago. We did not want to go bare hand. We created a hospital on wheel with common diagnostic equipment so that the community feels closer to us, opens up and talks to us, because we are also providing them some help at their doorstep. Our interaction in the community was emerging. We touched about 100,000 lives. Through our interactions, we found out that 99% of the people, for their medical problem, actually do not need hospitalizations or admissions. They can be treated as an OPD patient. They can be treated as an OPD patient. We also try to understand what their problems are, what kind of doctors should be needed, what kind of technologies needed to treat them, and what kind of hospital they would like to stay in. And also look at the community, what kind of money they can spend, not what is available in the market. Based on the understanding from the community, we started designing a hospital, having lots of brainstorming exercise with the hospital planners and designer. A hospital was created by involving the local community. They constructed the building. We tried to use the local materials. And as a result, we could complete the project 9 months ahead of schedule. It was supposed to be completed in 2.5 years. We did it in 21 months. It could have been 4 months earlier because of the flood and rain. We could not work in Assam for 4 months' time. Otherwise, it could have been done even much earlier by involving the local community. We also tried to use the local material as much as possible. We made it an eco-friendly green hospital, and probably for the first time in the country, this would be a gold certified green building in India, a hospital which is eco-friendly. Then when the hospital was completed, we realized that for accident and emergency problem, our people do not keep money for health care. It comes without any warning. They have no time to get ready for it with money. But initial 2 to 3 hours is the golden time for treating any medical emergency or accident victim. We decided to make it free in our hospital, just to see what happens, whether we become successful or not. So all patients, irrespective of rich and poor, we treat in that hospital free of charge for initial 24 hours, including medicine, including CT scan, X-ray, ECG, whatever they need to save their lives. We started providing free transport to the patients in order to make it easy to come to the hospital for their OPD care, outpatient care. For emergency services, of course, there are services of 108. Also, we have ambulance, which brings patients without any cost. The OPD services are very, very nominal. Doctor's consultation fee for surgeon, physician, pediatrician, obstetrics and gynecology, CNTI, is only 60 rupees. We are doing good and planning to do away with from 15th of August. We'll be able to run this hospital even without taking consultation fees. For the neurologists, cardiologists, and other super specialists, it was only 20 rupees. I must also tell you that there is no registration fees separately, as you see in most of the private hospitals. We do MRI at 2,500, almost equal to, even lower than some of the public hospitals. We do CT scan at 900. We do blood sugar at 21 rupees. We do X-ray at 60 rupees. Even after doing that, in less than 6 months' time, we are able to recover almost 90% of our operational cost. We borrowed this money from the bank. We did not get any grant or contributions from anybody. It's not a hospital, not for profit. We will have to earn profit because I have private equity investor. I must give them return on their investment at 25% IRR. But looking at the trend, this hospital will achieve break even in a time span much shorter than the so-called private corporate hospital. Because of the response of the people, the story got published in no time. It was published in 1,000 media in 10 different languages across the country, across the world. It came to the attention of Bill Gates. He commented that it's a great approach. By following simple business logic, we are able to reach and treat more and more number of India's poor. When Bill Gates tweeted it, it was read by 18 million people across the globe about this story. Not only that, another international publication commented that it's a unique frugal healthcare delivery model set to expand in India. And he commented that a newly set up hospital in the northeastern Indian state of Assam has cracked the access and pricing barrier. We could probably do that. It caught the attention of the World Bank. They came to study the model. They encouraged us by giving us a reward of $150,000 US for capacity building and scaling up. They told us repeatedly, we'll handhold you, we'll support you. Would you be interested to take it outside Northeast, outside many states of, in different states of India? Would you be interested to go to Bangladesh and Myanmar, where there are so many poor people? Would you be interested to take it to African countries? Ladies and gentlemen present, this is our unique experience, which I wanted to share with you. I can understand the value of your precious time. I would not like to take much of your time. You might ask me, before I leave the platform, how we have been able to make it possible, how the economics works. I must tell you, when this model will mature in another 6 to 9 months' time, we may not have to charge any money for the indoor and the ICU patients, which makes people bankrupt. During my so many 4.5 decades of association with healthcare services, I have seen many people from the middle class coming down to below poverty line when they get admitted. We have no control when we'll be able to release them. They have no control when they will be able to take their patient out. They sell their, they finishes all their savings, they sell their all movable and immovable property, they come to the street. It's the scenario all over the world. What we are trying to do, we have inverted the pyramid. All the private hospital survives on indoor patients and ICU admissions. 85% of their revenue comes from indoor and ICU admission. So they keep patients, there is a tendency to keep patients for more than required time, sometimes over-investigate them. Not only that, in order to grab that 20% of the people who can only afford them, there is unhealthy competition amongst them, unethical practices growing up. Not that society do not know about it. As a result, people are losing trust in the medical community very rapidly, which is a very disturbing sign. But when we inverted the pyramid, we took care of the base of the pyramid, which is the OPD patients. All our operating costs for the hospital comes from OPD patients. In 6 months' time, against the norm of 85% revenue from indoor patients and only 10 to 15% revenue from OPD patients, our more than 50% revenue comes from only OPD patients. And OPD patients' consultation fees is only 60 and 120 rupees. We even provide them transport. We do the investigation at ultra cost rate, and the average expenditure of an OPD patient is less than 1,000 rupees, including medicine, which is affordable to large majority of the people. That's what we have done. By inverting the pyramid, we are changing the dynamics of healthcare. And if we become successful, probably it will solve a big problem, not only for the Northeast, but across the whole globe. Thank you very much.
Thank you very much, Dr. Barua, for a very heartwarming account of how you have managed to set up a hospital in Assam and shown us another model. And I like the way you described the difference between private hospitals and government hospitals. Thank you very much. I hope to interact more with you over tea. Can I now invite Mr. K.V. Varke, the Managing Director of Hindustan Antibiotics Limited, to please address the gathering.
Good evening to all of you. First of all, I am thankful to the organizers for selecting me to speak on this topic, because 25 years of my career I had been handling information technology, and 2 years back I have moved to health-related industry, Hindustan Antibiotics, as Managing Director. So mHealth is the topic which I prefer. And I'm very much impressed about the initiatives taken by Maharashtra government in the mHealth sector, as we have seen from the previous presentation. As a person who has been passionate to promote information technology in the country, I'm very happy about it. In the early 80s, I have ventured into write computer science in Malayalam. It was taken well by the public, and finally it ended up in publishing 8 books in information-related topics. And I am happily watching how India is forging ahead among the nations in the IT sector. Coming back to mHealth, All of you know mHealth stands for mobile health. And mHealth is a subset of eHealth, electronic health. Functionally, both are same, but technically there is a difference. In eHealth, the infrastructure used is the traditional IT networking, that is wired networks, whereas in mHealth it is mobile devices, wireless networks. Watching the developments happening in the healthcare sector and the information technology sector, I observe vast scope for the country and for the people in mHealth. I also observe that the country is well equipped to harness the benefits of mHealth. One of the previous presentations we have seen how the country is gearing up with creating more bandwidth in the networking, because mHealth requires high bandwidth because pictures, X-rays, all have to be transmitted over the network. Through mHealth, there are various services which we can deliver to the people. One is in the administrative side that we have already seen. The health information system, that MIS system for the health department. The information about the administration of health department right from primary health centers to the administrative head of the health department. Then comes the patient information system. Morning we have been hearing a lot about the UID. So if the Aadhaar number is connected to the health information of every citizen, just by giving the Aadhaar number to the doctor, within few seconds, the doctor gets all the data, all the medical history of the patient in his computer, so that lot of time and effort can be saved. Lot of diagnostic testing can be avoided, because till yesterday, what is the condition of the body is available on the screen of the doctor. So treatment can be started quick. Otherwise, what is happening? Even if the patient is going to die, much of the valuable time will be wasted on testing and testing. By the time all the testings are over, patient may die. So this, then these underdeveloped countries, this health is very important, because there are a lot of rural areas where these latest medical facilities are not available, and good the super specialist doctors are also not available. But through telemedicine, even medical data can be transmitted to the super specialists sitting in big cities or in major hospitals. The ECG reports or the test results can be sent, and instantaneous diagnosis can be done and a treatment can be started. Another area is the medical documentation. We all know about this medical transcription happening and for insurance purpose and all. More than this, what is more contributing is the advent of more sophisticated monitoring devices of the human body now being made available in the market. Today is 2nd August 2014. Let us go to 2nd August 2019 to the consulting room of a cardiologist. A lady comes to the doctor for a heart checkup. That time he may offer her a new brazier. I am referring to the Techno Bra, a new kind of brazier developed by a company in Paris, which can be worn by ladies, which is embedded with electronic circuits, which monitors the heartbeat. If the heartbeat is normal, no problem. But if any abnormality is noticed, the message will go to the husband or father and simultaneously to her doctor. And instruction for, if it is serious, instruction for the remedial measures will be generated and action will be taken immediately. Now that nanotechnology is contributing much to the medical technology, instead of inserting the pacemaker and all, now a nanomaterial membrane has been developed in one Illinois hospital, which can be covered in your chest. It can be fixed on your chest, so that whenever the electronic pulses which controls the heartbeats are not proper, it gives corrective shocks, so that heart will work normally even if any problem is there. And if this is repeated many times, the database will collect it and proper information will be sent to the concerned doctor. Similarly, there are the wrist bit, that is the monitoring devices which you can wear like a wristwatch. It will monitor your pulses. Any abnormality is there, it will give you proper signal. Just like that, any body symptoms can be sensed and transmitted through wireless networks to anybody, anywhere. So this avoids the frequent visits to the doctor for checkups. It avoids a lot of very costly diagnostic procedures. If a signal is there that something is abnormal, then only you go for detailed testing. So it saves a lot of money. This is very important for countries which is finding it difficult to mobilize the resources for medical care. And for the sensing devices worn in the human body, most of them are working on batteries. To provide electricity for the same, body itself can create battery through nano technology. You know this, by the movement of your dress, such movements can be, that creates some energy. Very little energy, but that is sufficient for the functioning of the mobile devices worn by the humans. You might have read about the piezoelectric shoes. Anyway, while walking, there are a lot of energy is created because of our weight and the friction on our shoes. If a piezoelectric material is kept in the shoes, while walking, electricity can be generated, and this can be used for the mobile devices kept on your body. How is it possible? That is called a PAN. After LAN and WAN, now this is PAN, that is Personal Area Network. Through the dress you wear, nowadays the dress can be embedded with narrow electricity transmitting, conducting wires, so that a network can be created within your body, which can be connected to the mobile devices, to your ornaments, to your watches and earrings, all those things. And these things will work after, by talking each other, and if any abnormality is noticed, signals, messages will go to the concerned persons. And to complement this GPS navigation facilities to locate you where you are, if you are out of station, where you are located, so that treatment can be arranged at the earliest. That is also now available. The advantage is that country like India, where a lot of rural areas are there, where the traffic, wired networks have not reached. Even electricity is not there, but mobile phones are there. In this kind of situation, the most sophisticated treatment facilities are made available to the common man very fast and very effectively at very less cost. This is very important from the economic point of view. In addition to that, this mHealth provides a lot of business opportunities and job opportunities for the upcoming young generation of our country. Considering the demographics, the so-called demographic dividend of our country, which we are possessing now, this kind of job opportunities and business opportunities are very important. This is more relevant for India because India is now a leader in information technology. So when the devices which I was talking about, it will be millions and millions of devices because our population is now more than 120 crores. Even 1% of the population uses such devices. It itself is a big business. Not only selling the manufacturing and selling the devices, these devices require servicing, it requires applications, software applications. And software applications have to be supported. Once we are mastering this kind of expertise, it is not only India, because only Indians can master, develop and master this kind of expertise at cheaper levels. Then definitely, just like our software services, other countries will have to hire our services and our companies to avail these services. It is going to open a very good opportunity for business and employment for our people. I'm very happy to find that companies like Dell, HCL, GE Healthcare have all realized this potential, and they are already in the line, and a lot of activities have taken place. They are already realized the advantage. Not only that, next to information technology, pharma is an area where India is contributing much to the world through exports. 85,000 crores of rupees has been earned last year by pharma exports. But very few medicines are developed in India because research and development for pharma is very costly. If you try 1,000 medicines, 1 or 2 will be finally commercially marketed because it takes a lot of time and money. It is estimated that 40,000 crores of rupees will be required to successfully develop and market a new molecule. But thanks to the modern technology and the developments in nanotechnology and chemoinformatics, this time and cost of research and development can be brought down like anything. Now that anyway, research and development, this clinical trials is a very costly affair. Now, because by 3D printing, three-dimensional printing, we can create artificial organs. These artificial organs are capable of conducting the first or second level of clinical trials. Last trial can be on actual human bodies. So this kind of technologies can cut down the cost of research and development, and that is going to be helpful for India. Anyway, there are a lot of things. Other speakers are also there. I am cutting it down. But one thing I want to, finally, one thing is that this mobile applications for mHealth is developed mostly by IT experts. Doctors are not involved. Day by day, doctors are sent out of hospitals and engineers are conquering. The danger is that many applications are not properly regulated, that is, it is not tested properly. The Food and Drug Administration of the authorities are very much aware of it. A lot of actions are being taken. Anyway, mHealth is here to stay. We are gearing up, our country is gearing up for the same. Let us hope the best will come out. Thank you all. Thank you.
So much, Mr. Walke, for a very detailed presentation and all these interesting things you told us. Can I quickly invite now Mr. Sanjeev Tyagi, Director Sales from Juniper, to please give his presentation.
Running late of time, so if people are awake, I'll not take much time. If they are sleeping, then I'll have to explain it further. So I'm Sanjeev Tyagi, and trust me, madam, I will not take more than 10 minutes, or maybe try to make it further short. I'm going to talk about how IT can help to transform healthcare. I'll show some statistics in terms of what is industry challenge right now. What are the technology trends which are prevailing? Already some of the technology trends and applications are already been explained by a few of the presenters, so I'll not take much time out there. And what Juniper in terms of network and IT security vendor can do to ensure the healthcare is available in the faster possible time frame. So in terms of challenge, this is one statistics which has been shown out here. If you look at the people dying in a plane is 1:10 million. So when we have taken this flight, I'm pretty sure nobody from your relative or friend had said, had told you best of luck, you are going in a flight, best of luck to you. But whenever we are going to a hospital, we are seeing our relatives and friends rushing to the temple and praying for our health. And the reason to that is 1 out of 300 people are dying in a hospital. If we look at the survival rate from crash, that is even more pathetic. Globally, as well as in India, is the ambulance and the survival rate in the crash is really, really very bad. If I look at Indian statistics vis-a-vis other countries, today we have around 25, these are old statistics, but we have around roughly 25% of the people are covered under health insurance, where compared to that other countries like Brazil, this statistics was there in 1965, what we are there today. So the statistics are not very, very good. And the reason to that is somewhere we are not investing too much onto the health segment. Like if you look at the percentage GDP expenditure, so our expenditure is 6%, compared to that USA is spending some 17.6%. The MRI scanners available for the population of citizen of country is not even 1 per 1,000 citizen. We are exporting a lot of nurses, and we are also importing when there is a crisis in Iraq or Syria. But the fact is, not even 2 nurses are available in country for every 1,000 citizen. And so do about the physicians. Not even 1 physician is available for 1,000 people. So clearly there is a problem out there, and one thing which can clearly help and come out as a savior is IT, information technology. So the way it can do is, there is one analysis been shown, it's a global analysis on US, on diabetics patient. So total expenditure on diabetic disease in US is around $41 billion. So just by using a simple technology of remote monitoring, there can be clear saving of around 15% on curing such patient. Of course, what is required is we need to have a dedicated frequency for mobile health application, which has already been approved by FCC in year 2012. So today we have a dedicated frequency available. There are a lot of application, mHealth application, which have been downloaded on Android and Apple phones and devices. Some 44 million apps were been, healthcare apps were been downloaded in year 2012. And we are seeing this ratio is increasing. And in the span of 4 years, this ratio is going to become 4 times to 160 million apps that will be downloaded. So what is required in healthcare is, first of all, we need to digitize the record of a patient. Okay. All the details need to be digitized. It need to be available to various health organizations like hospital, like institute, research institutes. And these records need to be available at any point of time, either statically, either on a static media or onto a mobile media. So how can we ensure health delivery? If I look at some examples which are available, when we are going for a repeated visit to a doctor, like to give an example, my son had a viral fever. I was pretty sure when I will go next time, he'll ask me to remove the antibiotics and continue with the vitamins for 1 more week. But I was being enforced by my wife to go out there, because that is something, as a human tendency, we always do that. So just by using a remote monitoring application, and of course making sure we are paying to the doctor for the visit fee, we can reduce 73% of the repeated visits of the patient to the hospitals or the dispensary. Of course, we all want to know, get the repeated updates of the regular health checks. So 80% of the patient want some application which can give them repeated reminders of their health checks. And even if you look at towards the doctor side, all the doctors, either they are using Apple gadgets or they are using Android gadgets. So that means they also have the right hardware with them by which they can enable remote and mHealth delivery. So what Juniper aim is? Juniper aim is to reduce the cost of health delivery, of course to enhance outcome and improve access of a doctor to a patient. So this is possible by having a connectivity, a right connectivity of a patient to the doctor, to the hospital. The connectivity should be in mobile in nature, and it need to be secure, very secure. So when we are digitizing the data of our patient, of course that is going to bring us into one other problem of how we are going to manage that data. And then the problem of big data has already started coming up. But the good thing with digitizing the data is we can have more predictive trend analysis. Like this example been given out here. There were around 50 million people died of flu in year 1918, wherein there were only 5,79,000 people who were affected and died in 2009 because of H1N1 virus which got spread. And one reason to that was the government was able to take proactive measures to ensure the spread of this virus is been limited and can be contained. Of course, when we are keeping the data of a patient, it's very important the data centers need to be secure. The data has to be made available only to the person who requires it, only to the hospital, only to the doctor when it's required after due authentication and authorization from the patient or his relative. So security play a very important role out there, and Juniper is one of the vendors who is offering security for such data centers. So as a summary, what Juniper vision in a healthcare is, give doctor more time to patient, make it easier for IT to deliver services, and enhance patient clinical experience. I'll summarize my slide and I'll finish my presentation with one of the video which shows how IT can help in delivering emergency services to a patient. Thank you.
Also, Mr. Sanjeev, for this very excellent presentation. I think, Mr. Zia, you just have a few comments to make, not a presentation. Mr. Zia Saqib is Executive Director of CDAC Pune.
A small correction, ma'am. I'm from CDAC, Mumbai. Yeah, as a last speaker, I have to wrap it up so that we can proceed for tea. I'll just briefly mention CDAC's initiatives in eHealth and mHealth in the last few years. Many of you may be aware of our initiatives such as the open source drug delivery program, which was started a few years ago, one of the flagship programs of CDAC, which has helped many pharmaceutical companies, startup companies, as well as researchers to design drugs in India at a fraction of a cost what would have costed in the earlier days. And we're very proud of it. Other initiatives in eHealth and mHealth include the eSanjeevani project, which is actually a mobile, it's a van, it's a bus, which is deployed in some districts in Kerala to detect and initially treat cervical cancer. And hundreds of lives have been saved because of that project in Kerala. Then we have the Sanjeevani software and the Mercury software, telemedicine software, which has been operational for the last 10 years or so, much before the jargon of mobile health and mobility actually started off. We have Noida, which is one of the pioneers of patient information health management systems. And along with this, we have a very recent initiative of Government of India called Mobile Seva, which is trying to integrate some of these information repositories and disseminate it to the citizens through well-known channels such as SMS, interactive voice response systems, USSD, and even location-based services. So overall, CDAC is pretty much into transformation from eHealth to mHealth, but we are not a core health sector industry. So as far as IT is concerned, mobility is concerned, we are pretty much there. And if there's any help, which is needed in these areas, we'll be very happy to extend in whatever manner we can. Thank you, and being the last speaker, I'll not take much time. Thank you, ma'am.
Thank you very much, Mr. Zia, for a very short presentation. I thank all of you for being so patient and allowing us to finish. I thank all the speakers who joined me on the days for this session. And I'm sure that there will be things we can discuss over tea. Thank you very much.